Hello, my name is Rolf Craven. I teach pharmacology to medical, dental, graduate, and undergraduate students. This is not designed for students. This is just for people who may be using flu drugs, who may need medicines for their flu, just to give you an idea of how the drugs work and what are their side effects and their limitations. This is not designed to alter your prescription or your diagnosis, only to educate you about what drugs are out there. This is flu season. A lot of people are getting sick. In 2014 and 15, the flu vaccine works. It just doesn't work against the kinds of flu that people are actually getting. The best way to prevent the flu is through good hygiene. Wash your hands a lot, use hand sanitizer, and then stay away from areas where there's lots of sick people. Sometimes that doesn't work, and then you want to try something that might make your cold better. Flu is caused by a virus. So this is different from a bacterial infection, and so the kinds of antibiotics that you grew up hearing about and using are not useful against the flu. In the old days, doctors used to give bacterial antibiotics anyway, just to really make people happy. And they don't do that so much anymore because a lot of the bacterial strains have become resistant to the antibiotics, and so the doctors are saving those drugs for pure antibiotic infections. It's a good idea. If you do use them, make sure you go through your entire course of antibiotics. There are several different kinds of viruses, and they're classified by how they replicate their genetic information. Some viruses use a chemical called DNA, the same way that we do. And these include viruses that cause things like herpes, papillomas, and other kinds of diseases. Other viruses use a chemical called RNA. These would be the kind of viruses that cause HIV, Ebola virus, as well as other kind of more common infections like mumps, rabies, and polio. And the flu viruses are in this class. The key to killing a virus is to find something unusual about it that's different from how our cells replicate. That allows you to have a way to target the virus specifically. The way viruses cause infections, things like the flu virus, are they essentially grab your cell's front door and are then sucked into your cells. They then take off their coat, replicate their genetic information, put their coat back on, and reattach to the front door where they're shed into the bloodstream to infect other cells. Fortunately, we have a drug that can block the virus from taking off its coat. It's called amantadine. The unfortunate thing is that many viruses are now resistant to amantadine, and so it's not very effective. After the virus copies itself, again, it will put on a new coat, and now it'll reattach to the front door to be shed away. We also have a trick to stop that from happening. We can leave the viruses stuck to the front door so they can't be shed. Drugs that do this are called oseltamivir and zanamivir. You may have heard of these as Tamiflu and Relenza. And they work. They will leave the virus attached to the front door where it's relatively harmless. The bad news is that for these drugs to work, you have to catch the infection very early on. So for most of us, I wait till I get really sick, then I go to the doctor, and at that point there's not much you can do. If you're in a situation where maybe your health is compromised, or for elderly people, you may be in a setting where you can sort of see the flu spreading, where you would be aware of when the first onsets are of your symptoms. That would be the time to get clinical treatment and get the drugs. It's not thought to really improve the intensity of the infection, but the duration, so it can shorten the amount of time that you're sick. Many doctors, once the flu starts, will recommend anti-inflammatory drugs. These could be things like ibuprofen, and that's really a personal choice of whether you feel that the fever is something that needs to be addressed. It should always be monitored. A lot of cough medicines, so flu will progress to a cough, and people will take cough medicines. One of the main active ingredients in the cough medicines are a variety of antihistamines. These are sort of older antihistamines, and what they do is dry out your passages, and then they also make you very sleepy. One of the things you need to do when you get the flu is to rest, and these can make you pass out for a while. There's a lot of controversy about whether drying out the passages in your airways is a good idea when you have the flu, or whether you really should be producing mucus and trying to shed some of these viral particles. So what about all these other cold and flu treatments? The jury is still out on them. According to the Mayo Clinic and to the CDC, the Centers of Disease Control, drugs like Zicam, echinacea, vitamin C, and airborne have not been proven clearly to be effective in clinical trials. There are a lot of observations, and you can take those for what you will. There's a link down below to a really nice website from the Mayo Clinic about how these different kinds of drugs work. Generally, right now, there's not a lot to support using those as a main treatment for the flu. Still, people love them, so who knows? Maybe the clinical trials haven't quite hit the right target yet. Oddly enough, good old chicken soup is actually quite effective against the flu. No one really knows why. Maybe it does something. There's some ingredient in it that stops the spread of the virus particles or eases symptoms. But that's certainly something. It tastes great when you're sick, and many doctors recommend that. Other than that, staying hydrated and getting lots of rest are the main treatments for the flu. I wanted to just say one more time, this is not medical advice. This is just a description of how the main drugs for the flu work, why antibiotics are not effective, and then what some of the ingredients are in the over-the-counter cold-type medicines. I hope this has been informative. Please leave a like or a message down below if it has been helpful, and thanks very much for watching.